Assalamu alaikum, I'm Ra'a Asim, and today I'm going to be talking about hypercalcemia and some of its causes, including parathyroid adenomas. So first, let me quickly go over what we're going to be covering in this presentation. First of all, we'll talk about hypercalcemia, its causes, what actually hypercalcemia means, and then we're going to be talking briefly about parathyroid adenomas and the clinical picture of it, so what the patient can be presenting with, and then how we can diagnose parathyroid adenomas, what are the possible complications, and what are the different treatment options for the parathyroid adenomas. So let's get started with hypercalcemia. So right now we're going to be talking about what is hypercalcemia, but before we get into that, I'm just going to speak very briefly about the functions of calcium in the body so that we can know what will happen if the serum level of calcium is disrupted in any way. So we know calcium is very important for the bones and teeth. We know it is very important for the heart contractility, for skeletal muscles contractility too. It's also very important in blood clotting and it has many different functions in the body. So what is hypercalcemia? Now, the normal serum level of calcium is usually ranges from 8.5 to 10.5 milligrams per deciliter. So we do have three different levels of hypercalcemia, which is mild, moderate, and severe. Mild is anything that is higher than 10.5 but not more than 12. Moderate is between 12 and 14, and severe is greater than 14. We have different reasons for each level of hypercalcemia that we're going to discuss later. So now I'm going to be talking about the causes of hypercalcemia, but before that, let me discuss the ways by which the body actually maintains the calcium level at around the normal range, which we said is from 8.5 to 10.5 milligrams per deciliter, and that's mainly through three different ways. Number one is the bone resorption, which is the mobilization of calcium from the bone into the blood. And number two is through the gastrointestinal absorption of calcium, right? So the calcium that we consume in our diet. And then number three is the renal excretion of the calcium, right? So if you think of it, how can calcium accumulate in my body? So how can someone get hypercalcemia? It's either maybe that your bone resorption is increased, all right, some issue with your bone, or maybe it's an increased gastrointestinal absorption of calcium, or maybe some issue with your kidney that's really preventing the excretion of calcium through the urine. So another very important factor that we have to discuss as well is the parathyroid hormone. Now we know that the parathyroid hormone is released from the parathyroid glands in order to, again, keep a calcium level at around the normal range. All right, so if it drops, then it basically more parathyroid hormone is released in order to increase it back to the normal level, and so on. Parathyroid hormone is also very, very important because it also increases the amount of active vitamin D by increasing the activity of the enzyme that produces that. And another point that we also have to remember is that it also controls the phosphorus level. Now, you need to know that whenever calcium increases in the blood, phosphorus decreases, and vice versa. So they are always, kind of, opposite of each other. All right, and so if there's any kind of disruption of parathyroid hormone, for example, if there's an oversecretion of parathyroid hormone or undersecretion or whatnot, so obviously that will cause some disruptions in the calcium level. Now let's briefly talk about parathyroid adenomas, but before that I just want to mention that almost more than 90% of the cases of hypercalcemia are caused by either malignant cases, all right, or primary hyperparathyroidism. Malignancies cause hypercalcemia by basically by releasing the parathyroid hormone related peptide. However, primary hyperparathyroidism basically means that there's an issue in the parathyroid hormone, in the parathyroid glands, that basically causes them to release excessive amounts of parathyroid hormone. Now, about 80% of the cases of primary hyperparathyroidism are caused by parathyroid adenomas. So it's a very important topic, and now we're going to discuss it in more detail. We can think of parathyroid adenomas as they are obviously benign tumors, and they're just these abnormal growths that keep on secreting parathyroid hormone without any regulation from calcium. So normally, if you think of it, right, when the calcium level increases in the blood, what would happen is that the parathyroid hormone would automatically decrease, all right, by a negative feedback loop in order to, get the calcium level back down. But what happens with parathyroid adenoma is that it's not under the control of calcium. So even if the calcium is increasing in the blood, the parathyroid hormone is still being released by the cells of the parathyroid adenoma, and that's the main concept that has to be understood when we're talking about parathyroid adenomas.
Clinical manifestations of parathyroid adenoma. Many patients with parathyroid adenoma are asymptomatic, and those with symptomatic parathyroid adenoma will most commonly manifest with the same clinical picture as hypercalcemia. The symptoms include bone pain, fatigue, polyuria, polydipsia, urinary stones, constipation, vomiting, neuropsychiatric disturbances, including confusion and depression. Investigations. How to diagnose a parathyroid adenoma. Our first clue is hypercalcemia. Once the diagnosis has been established, more tests can be done to gather more information and check for complications, including system-EB scan, neck ultrasound, DEXA scan, CT scan to check for calcium deposits in the kidney and urinary tract, a 24-hour urine test to measure the amount of calcium lost in urine. Complications of parathyroid adenoma. Osteoporosis and the increased risk for pathological bone fractures are the most common concerns. Other complications are less common but may include nephrocalcinosis, ostitis fibrosa cystica, recurrent laryngeal damage, and parathyroid gland damage. The treatment is surgical removal of the affected gland, parathyroidectomy.